This is All India Radio. In the program Spotlight, now we bring you a discussion on World Tuberculosis Day, TB Prevention and Control. The participants are Dr. Tanmay Talukdar, Professor and HOD, Department of TB and Chest Diseases, Lady Hardinge Medical College, and Omvesh Upadhyay, AIR Correspondent.
We recognize World TB Day on March 24. This annual event commemorates the date in 1882 when Dr. Robert Koch announced his discovery of Mycobacterium tuberculosis. World TB Day is a day to educate the people about the impact of TB around the world. And today, to discuss on this in detail, we are joined by Dr. Tanmay Talukdar. Dr. Tanmay, what is this year's theme and how significant it is?
Every year, WHO comes out with a theme to raise the awareness about TB in the community and among all stakeholders and highlight not just the health but also social and economic consequences of the disease. So this year, they have come out with the theme and it is called Yes, We Can End TB. So here WHO wants to focus on newer evidence-based recommendations which they have come up with, increased visibility regarding TB all around to combat the disease, to have more community participation, bring in the newer initiatives which have come up, adopt them, and most importantly have multi-sectorial collaboration and community participation. So this is how they are saying, yes, we can go about and end TB.
What are the symptoms or initial signs through which we can identify that it might be TB?
70% of the TB actually happens in the lungs, so the symptoms pertain to that organ, and it is cough more than 2 weeks. We say if the patient is having fever, a long fever around 2 weeks, which is not going away, weight loss, patient not feeling hungry, occasionally they may bring out blood in the cough, and also sweating in the night if it happens with fever. So we think that this could be TB, and hence we should get ourselves investigated. Apart from that, TB can affect so many other organs of the body. In fact, all the organs of the body can be involved. We say that nails and hairs are not involved. Apart from all other organs get involved with TB. And hence, we also have organ-specific symptoms. For example, if it's due to the stomach, then we'll have difficulty in eating. We can have pain abdomen. But the four main symptoms remain: cough, fever, weight loss, night sweat, and not feeling well.
Then, Dr. Tanmay, are there types of TB as well, and what tests are done for TB diagnosis?
Yes, we just discussed that we have TB which is involving the lungs, 70% approximately, pulmonary TB we call it, and also the TB which affects all other organs. They are clubbed together and they are called extrapulmonary TB. Extrapulmonary TB is a little difficult to diagnose, but now we have technical tools to deal with it, and today Honorable Prime Minister Sir has released the extrapulmonary TB training module also, which would help us people, stakeholders involved in TB treatment to diagnose and treat. So these are the two main types, but then we also have different types as far as resistance is concerned. Some patients have TB where all the drugs work well and it is called drug-sensitive TB, easier to treat with simpler drugs. Whereas if some of the drugs don't work, we call it drug-resistant TB. It is a little more difficult, but cure is definitely there. But then it may take a little longer time. Drugs may have little more side effects. But then I would like to clarify here very clearly that there is also cure for drug-resistant TB. So nothing to worry if we follow the rules. So these are the two main types. Now coming to the second part of your question, that how do we diagnose it? Conventionally, the pulmonary TB was diagnosed by using the microscope where we look for this bacteria. It's called Mycobacterium tuberculosis under the microscope. But now we have more different advanced technologies. We use what is known as the rapid molecular diagnostic techniques, and we have a network of such techniques all across the country. And I would like to again remind that all TB diagnosis and treatment is absolutely free in our country. And by this rapid molecular diagnostic technique, we call it NAT, nucleic acid amplification test. This is the primary method of diagnosing TB.
And there's also a talk of comorbidities, that how other illness or diseases can affect the severity of TB, per se diabetes. So if you can also throw some light on that.
Yes, definitely. Comorbidities, some of them play a major role in TB. They have a role everywhere. In TB infection becoming a TB disease not getting well soon, and also drugs not working. So we have many such comorbidities, the major ones being lack of nutrition. So we have to be very careful about having a balanced diet. Apart from that, tobacco, cigarette smoke and alcohol have a very negative role on TB outcomes. So we have to be very careful and stay away from that. Persons living with HIV have more likelihood to have worse outcomes if we are not careful about our treatment. and also very importantly, diabetes. Diabetes brings down our immunity and hence there's more likelihood of having TB disease, and if we have the disease, to have worse outcomes. So it's very important that we not only think about TB, but those who have comorbidities, that is another disease along with TB, we must also very well take care of that, because it's very important to make sure that if the TB has to be eliminated, we have to take care of the comorbidities as well.
Dr. Tanmay, here we have seen that there's a general trend that when a patient initiates a treatment, and once they start feeling that the symptoms are gone, or they immediately pull out of it and stop the treatment. So for listeners, if you can inform us about what is the need and necessity to complete the treatment.
I would like to definitely bring in the point to our listeners that there are two issues primarily. Do not delay in diagnosing TB. If cough is there, we have to get ourselves tested and treated quickly, because if we don't do it, we not only get worse ourselves, but also we spread around 14 to 15 new people will get the infection. So that is one. Two, once we start the TB treatment, the drugs start affecting very quickly and we start feeling better. All our problems start getting better. Like the hunger would start coming back, we'll feel better, the fever will start going down. After maybe 2 weeks, then the cough starts going down. So the sense comes in that why do I need to take 6 months of medicine? This is a common question we get from our patients. But it is very important to understand that it is required to have a complete course to eliminate the entire TB bacilli, tuberculosis bacilli in our body, which is very, very important, because some of them go into hibernation, we call it, they go into dormancy, and they again come back later if we do not take complete treatment. So it is very important that we do not interfere with the treatment, we do not stop it in between, we do not change it according to our whims and fancies, and we complete the treatment as directed by your physician. It could be 6 months, it could be 9 months, as decided by your physician. You must complete the treatment.
And Dr. Tanmay, I was listening to Prime Minister Modi's address today in the One World TB Summit, where he launched the TB Mukt Panchayat initiative. And here we have to also talk about the different initiatives that are proving to be game changer that the government introduced. So if you can throw some light on these initiatives as well.
Last few years have made major changes in our TB armamentarium. I'll begin with what has been envisaged today. You asked about Pradhan Mantri TB Mukt Panchayat Abhiyan. So this involves the people's participation, the community's involvement, where the community becomes a stakeholder. We will take care of every patient of TB. Every suspect will be investigated for TB. If TB comes out, we'll treat it. We give them all the support. We take care of the family members that they don't develop the disease and provide them support as well. So when community comes in, the stigma reduces, the patient gets support, and definitely the outcome becomes very, very much better. In the same context, I'd like to also highlight the other major social activities which has come up. I have to talk about Nikshay Poshan Yojana, where the patient is given financial support for nutritional supplement. Every month, money goes directly to the bank account by DBT to the TB patient. This is one issue which is making a big change. Similarly, I'd like to talk about this telephone toll-free number. It is called the Nikshay Sampark. Any issue pertaining to the TB, if you believe you have TB, you have queries regarding TB, or if you're a TB patient now or in the past, and you have any questions regarding TB, we just have to call this number 1-800-116666. Apart from this, there is another very good movement which has happened, and that is Nikshay Mitra. Here again, the community support and community participation has come up, where individuals, corporates, institutions, NGOs, parties, everybody have put in their effort. And how they do it? They adopt a TB patient with their consent, of course, and provide them nutritional support. This is the Pradhan Mantri TB Mukt Bharat Yojana, and the people who are adopting, they are named Nikshay Mitra. You know, what happens is not only the patient gets support, but also community gets involved in this noble cause. So it's a win-win situation for all.
Dr. Tanmay, when I was going through news yesterday and I saw that by July this year, a monopoly of bedaquiline patent manufacture will not be extended in India. And now it is believed that the prices will be reduced drastically. So Dr. Tanmay, can we say this news is in patients' benefit? And I want to know from you how significantly it can impact the TB patients.
It's a valid question, because bedaquiline is now the backbone. You know, I began by saying drug-sensitive TB and drug-resistant TB. So one of the major drug-resistant TB which we have is known as multi-drug-resistant TB. Here, at least two of the most important drugs which we use initially for TB is resistant. By that I mean they do not work. So in this group of patients, bedaquiline is the most important drug, I can say, to treat patients of multi-drug resistant TB. And in India right now we have 2.84% MDR TB among new patients of TB. So that's relatively big number. So for that we need good regimes for MDR TB. And for that, bedaquiline is vital. And it's not bedaquiline alone which is given. In tuberculosis, there's another issue which our patients will have to understand. Unlike other bacteria, tuberculosis need a lot of drugs together. 4 drugs are taken, for example, in drug-sensitive TB. That's why we need counseling. That's why we need social support, family support, where today's program, the caregiver model which has come up, family caregiver model by which the family members would be trained, they would be empowered. So this is important, taking so many drugs together. Coming back to your question, yes, bedaquiline is vital for treating multi-drug resistant TB.
You mentioned about family care, and there's also a module, I guess you mentioned. We also have to think about the family aspect as well, that if some individual is suffering from TB, so how should the family behave and treat the TB patient? Because it is a communicable disease, so there could be some methods or how to safeguard themselves from coming in contact with the infection.
See, COVID has taught us a lot. So now whenever we have cough, everybody has learned that we have to cover our mouth when we cough. We have to use either the elbow or a napkin, or better still, we should wear mask when we are symptomatic. This is very important. We have to be socially responsible. Secondly, discrimination. It happens within relatives also. It's not just that somebody out in the road would be discriminating. So it is very important that TB patient needs support, and we have to protect each other, but then we have to not discriminate. Another important thing is, once the treatment has started, the ability of the patient to spread the disease to somebody nearby is minimized significantly. Here I'd like to focus that it is only the pulmonary TB which spreads from one person to another. The TB affecting the lung spreads from one person to another. And there also, after a few days of treatment, the treatment may be of 6 months, but this ability to spread to others is minimized very significantly and within weeks only. So we need not worry at all. Apart from that, most importantly, we have what is known as TB preventive therapy, and today also Honorable Prime Minister has launched the shorter TB preventive therapy treatment. By this, we protect the contact of TB patients if they are not having the disease, but they're just the contact. So there it is much simpler regime now. Only 12 doses is to be taken, 1 dose a week for 12 weeks. So that way also the patient gets protected. But again, the doctor will decide who deserves this treatment, how it has to be taken, how counseling has to be done. But then this TB preventive therapy also works. So we do basic precaution. Whenever we have symptoms, we get ourselves tested as early as possible. And if everything is okay, then we also must take TB preventive therapy. If somebody is having TB of the lung in our house, obviously as decided by the treating physician.
Dr. Tanmay, I remember in March 2018, during the End TB Summit, Prime Minister had called on India to achieve TB-related SDG targets by 2025, that is 5 years ahead the global target, and even today he reiterated that. But we know how pandemic derailed everything. We are also seeing that from district level to the national level teams, everyone is working hard to meet the ambitious target. Since you are from the industry also, how far have we progressed?
To bring the point to focus, the worldwide TB is declining by 11%, but in India it is around 18%. So we are slowly, steadily, and also now rapidly moving towards that target. We are notifying more and more cases. There has been 50% increase in TB patients registering into the health system compared to the base year of 2015. So what does it do? It says that more and more TB patients are coming out to get treatment. They are getting cured. How do we benefit out of it? They will be spreading it to less and less people. So we have a lot of issues which are happening. We have nutritional support, as I just told you, Nikshay Poshan Yojana, the Nikshay Mitra giving nutritional support. Community participation is coming in. The TB champions, the TB survivors, that is those who have already got treatment from TB and now want to communicate and motivate other patients. 30,000 of them working out in the community. So there's a lot of things happening, and I'm sure we are going to do very good.
And on that positive note, thank you so much, Dr. Tanmay, for joining us.
Thank you so much.
You were listening to a discussion on World Tuberculosis Day, TB Prevention and Control. The participants were Dr. Tanmay Talukdar, Professor and HOD, Department of TB and Chest Diseases, Lady Hardinge Medical College, and Omvesh Upadhyay, AIR Correspondent. This program was produced and presented by the News Services Division of All India Radio. You can listen to it on our mobile app, News on AIR. This program is also available on our YouTube channel, News on AIR Official. You may share your feedback about this program through email at airnsdtalks@gmail.com or WhatsApp on 92890940444.